Well, it can be a very embarrassing issue to discuss even with your doctor. But the truth is, at least 20% of women between the ages of 40 and 59 are not able to enjoy sex because of pain. The problem can often be caused by changes to a woman's body due to menopause. Here to discuss the common problem is Dr. David Herzog, an OBGYN and creator of a new surgical procedure that's showing lots of promise. Also joining us is Cindy Salamone of Lakewood, who was successfully treated with this new procedure. Thank you for joining us today.
Thank you for having us.
So, Dr. Herzog, first question has to be, is pain during sex on any level at any time normal?
My feelings are that sex should be a pleasurable experience, and there should be no pain at all. There's no reason for anybody to experience pain with any type of sex.
Mm-hmm. And Cindy, this is, you know, I admire you. I actually admire you for coming out and actually talking about this, because this is not something, as I said, a lot of women want to really talk about. Tell me a little bit about you, and how did this all evolve for you?
Well, after I was reaching menopause and I became postmenopausal, I would visit Dr. Herzog, since he's been my gynecologist for the past 20 years. And it was getting to the point where even on examination it was painful. So his discussion with me was, well, what's going on? What's happening when you have sex? And I said, well, obviously there's pain involved. So he did present to me the L.A.V.A procedure, and at first I said, well, I'm not so sure about something like that. What else can we do? And since I wasn't able to go on any kind of hormone replacement, he said, give it some thought, and I did. And I went home and discussed it with my husband, and we came back and discussed it a little more, and it sounded like it would be something that I would definitely give a try. And
so this is not something that you experienced prior to your perimenopausal years?
I would say that there was always an issue with some pain associated with intercourse. Mm-hmm. And of course, as Doctor said, you want to be able to enjoy that. Mm-hmm. So it would always be, well, you know, you want to be engaged and you know, be intimate. Sure. And there was always something that was stopping you, because you, in your back of your mind, mm-hmm. you said, that's not going to be as much fun as I'd like it to be. Right,
and that is a big issue. You know, if something is painful and uncomfortable, why would you even want to begin to think about doing it? So what are some of the more common causes of painful intercourse?
Well, the most common cause is a decrease of elasticity due to the menopausal drop in estrogen. And there are hormonal therapies that you could use. There are other as was mentioned before, vitamin D could be mm-hmm. used. There are mm-hmm. other different therapies, but there are some women that aren't candidates for hormones, and for those women, this procedure is able to sculpt the outside of the vaginal opening to allow penetration in a painless way.
Okay. Well, Cindy, you had this done, and after the procedure, you're fine? No issues afterwards?
It's been about 6 months since my procedure. Okay. And I have to say it gets better in time. Mm-hmm. And the best way I could really just summarize the whole thing was a comment that my husband made. And he said, it's like we're 30 again.
Well,
so
that's a good thing.
That was very nice.
That's
and,
a good thing.
And to be honest, it does get better. Mm-hmm. Right after the procedure, about a month or two, it was still a little difficult. Right. But now it's okay. Like it's always been that way.
Absolutely. Hey, Dr. Herzog, tell us what's going on here. We've got some video. Talk to us about this.
Well, this is actually a procedure that I did a few days ago. We took a video of the laser device, which is the YAG laser, and I was checking the laser, and the patient is all prepped and draped. And essentially, what we do is we do this procedure under local anesthesia with sedation. Mm-hmm. We completely numb the area so the patient doesn't feel any pain. And within a 30-minute time frame, I literally sculpt the outside of the vaginal opening in order to mm-hmm. make the vagina wide enough to accommodate the partner. And essentially measurements are taken, and up to this point, we've had 100% success rate.
Excellent. And when we're talking about a procedure like this, is this strictly an issue with the perimenopausal and menopausal woman? I mean, can this procedure be done for a younger woman, perhaps in her 30s?
Actually, a couple of days ago, I did the procedure on a woman in her 30s who happened to be with a partner who happened to be pretty well endowed, mm-hmm. and she wasn't able to have penetration with him. And I've done it numerous times on similar women. And because if something hurts, they're not going to want to do it.
True.
And this procedure allows them to have painless penetration. It doesn't interfere with their ability to feel the intercourse, to feel the frictional forces, because all I do is essentially sculpt the outside part, the outer 1/3 of the vagina. I do not do anything to the muscles on the inner 2/3. So the only thing it does is allow painless penetration.
Okay. Well, I thank you both for being here. Cindy, thank you very much for
My pleasure.
coming out and talking about this. And Dr. Herzog, keep up the great work that you're doing. Again,
Thank you.
Thank you so much for joining us.